Hello, I'm here with Dr. Mark Drucker, who is one of the new thinking kinds of doctors who's part of the Forever Health Network. What do I mean by new thinking kinds of doctors? The planet has changed, the environment is affecting our health, and this wasn't so in most cases in medical school, and doctors such as Dr. Drucker had to go back to school to relearn new approaches to health. Hello, Mark Drucker. Nice to have this opportunity to talk to you, Dr. Drucker.
It is great to talk, and let me just say thank you for doing so much hard work to make my job easier.
Good.
If I ever need to get someone understanding of what I do, I say, please go read Suzanne Summers' books.
Yay.
And you've done so much good work that it really is, it's helpful, I appreciate it.
Well, I think there's a great symbiosis between what I write and then when they come in, you don't have to start in kindergarten. You know, I always tell women the more educated you are when you go to the doctor's office, especially the new thinking kinds of doctors such as yourself, the faster you can get to work. Now, one of the things I see is that you do chelation. And
Yes.
I'm concerned about dirty blood. Can you tell the viewers what dirty blood can do to you and why chelation is such an important protocol?
Yes. So, first of all, we always start with a little bit of common sense. And Mark Twain said, common sense ain't that common. But I tell folks, what are you when you're fully poisoned? Well, you're dead. That's what we mean by fully poisoned. So as a person becomes partially poisoned, and poison is just another word for toxic. They clean it up in medicine, make it sound a little more fancy, so you're just toxic, but you're really poisoned.
Yeah. And
so if you're 30% toxic, you have lost 30% of your health and your vitality, and so on and so forth, 40 and 50%. So some of the major categories of these toxins or poisons, one is in the heavy metal category. And I listened to the music of Marvin Gaye for many years, and one day it dawned on me in his Mercy, Mercy Me song, he's singing about radiation underground, and in the sea, fish are filled with mercury. So we learned that from Marvin Gaye, but there was an awakening one day when the lyrics actually dawned on me. So chelation is a medical or even a home process of eliminating toxic heavy metals from the body. And the reason why I say it's either or is because in the office we use intravenous chelation, which can be more powerful and more aggressive, but people can do forms of home chelation where they're taking products orally by mouth, and this can be both chemical agents and medicinal agents as well as natural herbal products. So I was fortunate enough about 25 years ago when I first learned of chelation therapy, because you don't learn about this in medical school,
right,
even though it is part of Western medicine. So chelation is used in conventional Western medicine when there's an acute industrial poisoning. So plumbers and welders who get lead poisoned, they end up in the ER. And if there's a good doctor who puts two and two together, they are chelated or they get chelation therapy in much the same way that I use it for people that have accumulated metals slowly over time. So this is chelation therapy. And I was fortunate enough 25 years ago to actually travel over to the Netherlands. And I met who was a board member of ACAM at the time. And ACAM is the American College for Advancement in Medicine. These are doctors who have supported and promoted chelation therapy. And he was a retired, Dr. Peter van der Schaar was a retired heart surgeon. And he had operated with DeBakey down at Texas Heart Institute. And I was just fortunate enough to go and meet him. And at that time, I was young and I was naive. And I'm like, what is this chelation therapy? But he looked me in the eye and he said, this is really going to help your patients. So we use various forms of chelation therapy to get the toxic heavy metals out of people.
Well, and I know in my own family, my husband and I were exposed to black mold, the worst kind, Stachybotrys. It was in an unfinished room downstairs, and we had no idea that it was like Little Shop of Horrors. And the mold in my husband settled in the base of his brain, causing facial spasms. Now, when you go to a doctor, a normal doctor for facial spasms, right away they say Parkinson's. But what has helped him to eliminate the mold from his brainstem is regular chelation. And it was during that process that they found that he was not absorbing minerals. Do you find that when someone starts chelation that you start seeing there's a cascade of things that have been affected by the toxicity? Because the older we get, the more toxic we are, right?
Yes. So this is where it does get a little confusing, but it's really very simple. In various people, the toxic effects of metals destroy different organ systems. So in some people, it's the immune system. And when your immune system is weakened, it's not going to fight off the mold or the mold toxins as well. Mm-hmm. In other people, in classically mercury and heavy metal poisoning, it's the nervous system and the neurologic system. So there was a case of a professor of biochemistry at Dartmouth University, Dr. Karen Wetterhahn. She studied heavy metal toxicity. She died of heavy metal poisoning. And she had the classic symptoms of toxicity, mercury toxicity, that just weren't recognized in time.
Tell our viewers what those symptoms would be, because I bet a lot of people watching it will end up going, oh my gosh, that's me.
Okay, so I would say first and foremost is fatigue. And then second can be brain fog. So fatigue, brain fog, which can go into depression, which oftentimes becomes sleep difficulties. And then, depending on how it affects various organ systems, if it weakens your immune system, then you may have problems with, like your husband, a Stachybotrys mold, or just simple candida that's already in your system. Mm-hmm. So now you have candida symptoms, which are digestive complaints. So all of this and many more can be from the same heavy metal toxic issue. So the symptoms can be elusive, but with careful testing, and it always starts from a history. So in my patients who have the most heavy metal toxicity, it's primarily mercury from dental amalgams, which may have already been removed, but during the years or decades that the person had those amalgams, they were absorbing perhaps a lethal dose of mercury. So it's actually guesstimated by the World Health Organization that if you have 4 or more amalgams over several decades, you actually absorb a lethal dose of mercury if you were to get that dose all at one time.
So the old recommendation of fish as a healthy meal, I'm sure comes with caveats now, right?
Yeah, so that's number 2. So second to mercury in the dental amalgams is mercury in fish. And we even have a card here that we've gotten from it's from the FDA and the Environmental Protection Agency. And it lists all fish, unfortunately, with the exception of salmon, Pacific cod, or I should say Arctic cod. Most all fish has too much mercury, including tuna, which everyone loves tuna. And that's what I always look for in patients. I say, because I was a big tuna fish eater back in college and medical school. That was like the most protein bang for the buck when you're a starving student. And so I consistently find, were you a heavy tuna fish eater? And they say, oh yeah, for years I was watching my weight, eating low-fat tuna. And you can have levels that are really extreme in those patients. So we take in toxins through our skin, through the food we eat, through the air we breathe. We can control what we put in our skin, and we can control what we eat. It's hard to control the air we breathe except in our own home. So my understanding is that when these toxins come in, they end up in the GI tract and then eat through the barrier wall and then leak out.
Now, once they leak out into the bloodstream, is that where chelation comes in, or has it already affected organs and glands, or maybe the brain with ADD and ADHD and things like that?
Yeah, so it's by the time people realize that they have a problem, this has been years or decades. Mm-hmm. So the metals are already deposited in various organ systems, including bone marrow. So, I talk to experts in various bone marrow cancers, and they will tell me that they do see elevated levels of lead in the bone marrow of bone cancer patients. There are studies that show it can increase risk of heart attack because there's more mercury in the heart muscle cells of patients who have heart attacks. So it's already into the organ systems. And chelation has the ability to, first of all, clean it out of the blood, which then creates a vacuum so the cells can start dumping back into the bloodstream, where the chelator in this case, so we use two main medical chelators, and they're very safe, they have lower toxicity, they're equal to a food, they're less toxic than aspirin. So these two chemicals have a high affinity or attaching to the heavy metals, and we literally measure the urine of our patients to find out how much of the metal is being excreted and eliminated.
I found in the years that I've been writing books about hormone replacement, bioidentical hormone replacement, which I know that is part of your specialty for men and women, that women would write me and say, oh my gosh, I went on bioidentical hormones and I feel so great. Then I started hearing from those same women years later, it's not working anymore. Is that because of their toxic burden? It's now interrupting with their ability to absorb, or is it affecting the hypothalamus up in the brain, or what's going on?
So, Suzanne, it's the toxins along with, nutrition is a huge key. So we do find that a lot of people are not getting nourished properly. And my two main fundamental principles of health are nourishment and nutrition to build your health, and removing the toxins that destroy your health. So you're right on. Oftentimes at a certain age, the woman's health is of enough vitality that the hormones come along and they have the physiologic effect that we're working for. In other words, the cells are healthy enough to respond to the hormones. And then as the years go by, or maybe the person is accumulating toxins that they're not aware of because they haven't looked into this arena, or they're just still undernourishing, okay? So the average person may not give enough attention to the foods and the supplements. So eventually the cells in the organ system, their vitality and their performing ability, it weakens to the point that the hormones alone, you're whipping the horse or you're encouraging the horse, and it just doesn't have the energy anymore. So that is often the next step, which is why your book, Toxic, you see that, the hormones are great, but they don't work forever unless the foundation, I call it the fundamentals of health, are in place.
So to be healthy today takes some work and vigilance. So when I come to you as a patient, you're going to look at my hormone levels, right?
Correct.
Then what are you going to do? Give me your, this
All
is.
right, so the good news is I did learn this in medical school, right? So you really learn about the patient from talking to them. So that's the first thing. I'm going to find out, how your life is, your stress levels, relationships, how hard you have to work, how much the kids drive you crazy, and then a pretty good history on what you're eating, and a pretty good history on where and what toxins you may have been exposed to. Did you grow up in a farm area? Did you have a well when you were young? Did you work in the pesticide industry or industrial industry or live near? So we begin to get an assessment of your toxic level, of your nutrition level. Then, of course, we'll start to look at the blood tests like you're referring to. Right. So we're going to look at hormones, basic blood chemistries like a blood count and other chemistries, but we're going to look at a lot of vitamins and nutrients.
Mm-hmm.
We do this both in the blood, and we do this both using a very sophisticated computerized assessment. Ours is called the BioMeridian. We've been running this technology for 17 years. It works really well. We consider it our screening to figure out how the nutrition and the toxic levels are.
So is that BioMeridian, is that a blood test, or is that a urine or saliva? Or
This is a computerized test that uses microcurrents, which are run through each individual patient using metal conductive probes. So they hold on to a copper probe in one hand, and they get a copper finger point probe in the other hand. And then we go through hundreds of items that the computer has a micro frequency that represents the item. So mercury, for example, candida, parasites, various toxins like mercury, cadmium, lead, nickel, arsenic, tin. We'll get into chemical toxins, pesticides, cleaning chemicals, petrochemicals. Then we'll start assessing nutrients, so zinc and magnesium and chromium and vanadium, vitamin B6, B5, B12, folic acid, CoQ10. So we get a good kind of a basic level of, are you average? Are you really below average? Are you a little above average? Because maybe some people, luckily, are eating better these days.
Right.
We check fatty acids very, very thoroughly. So we're really focused on fat nourishment and the level of fatty acids in the body, because it's actually a key for nourishment, but it's a key for toxicity and protecting a person from the toxins.
I guess because we're living longer now than ever before, and we're under the greatest environmental assault in the history of humanity, that to continue down the allopathic road, which is here's my problem, here's the drug for that.
Yeah.
To me, just sounds like throwing more problems into a body that's already loaded up with toxins. Is that, by the time someone finds a doctor like you, are they already in the know? Have they been to a lot of other doctors and gotten no relief, and they're coming to you because they heard that maybe you'll be able to help them?
That's very common. So it's very common. There are a lot of people who have been to quite a few doctors. Mm-hmm. And for those conditions which really fall under our umbrella of a functional disorder. Mm-hmm. So in other words, it's very good for people when they have a obvious diagnosis like multiple sclerosis or Crohn's disease, or even a thyroid disorder that luckily the doctors can diagnose, so they can provide some treatment for that disorder. But then the next step, which is to solve the root cause. Okay, so what is causing this problem? How do we unwind it? That's not even a part of allopathic medicine. And that's really what people need to understand, what it's good for, because it is my background. I thought, I did great work when I had a patient who was in front of me dying because they were unstable, and we stabilized them and we saved their life right on the spot. But the medicines are never intended to actually solve or unwind or repair the damaged organ system that's not functioning properly and giving the person symptoms.
So what you're saying is the medicines are the Band-Aid that takes the pain away for the moment, but it doesn't fix the root problem of whatever's going on with this person.
It's symptomatic, you bet. It's a symptomatic relief.
So you must see your patients really improving, really getting well.
We really, in people that are able to be compliant, and so they understand they got to eat better, they got to limit the sugars and the fast foods. They'll take the supplements. I believe strongly in supplements when it's appropriate, when it's prescribed in the right dosages, in the right amount, for the right condition. I call it therapeutic nutrition. So you can have a drug that's therapeutic where it goes in and it sort of supports the physiology that's not working right. But you can have a high-dose vitamin that has nothing to do with a recommended daily allowance or the minimum daily requirement. It is supporting a system that's already broken. So higher doses can get that effect. And we see that in, vitamin D supporting the immune system, and B vitamins supporting the mitochondria of the cells creating energy. Because in the case of fatigue, oftentimes the cells are just disrupted. They're full of toxins and they're full of viruses and they're undernourished. And maybe they've even weakened over decades of being in this fashion. So they just don't work good. And so rather than a normal dose of vitamin B12, someone might need 5 times a normal dose. And then that cell that is damaged and weak can work a little better. It can perform better. And then, of course, that cell, people don't realize it's going to die off and be replaced by its replacement cell. And that little cell can now be just a tiny bit healthier than the one before. So it can work even a little better with the support that we're given.
So people can actually expect a rejuvenation by chelation, cleaning the blood, by replacing your deficiencies relative to mineral and nutritional deficiencies. But then what I'm hearing you saying, which I agree with, the food you choose is so important. How important is organic?
I believe it's very important. It, first of all, limits the toxic pesticides, which are devastating to a variety of degree in different patients. I mean, this is where people also get confused. Well, Uncle Joe never ate organics and he lived till 95, but some people can do that. That's not typical or average. So in medicine, we have a bell curve where most of us are in the average, and a few people are exceptional and they're bulletproof and they do what they want and they get away with it. And a few other people are very fragile and they have to be very careful about what they eat and the toxins they come across and even how we treat them. We have to be more delicate and take our time. So back to organic foods, I think it's very important because it limits the pesticides, and I also believe that the organic foods, because the soil is a richer, more fertile soil, has much higher nutritional value.
I read something recently that said if you're born before 1950, you got a better shot, because those of us who were born before 1950, we didn't eat organic food because everything was organic. It never entered anybody's mind to spray poison on food. Who thought that was a good idea?
Yeah.
So what you're dealing with is the result of what we all got lulled into was, well, if they're selling it, it must be safe, right?
Yeah, or I'm not even, I suppose that's true. If they're selling it, it must be safe. Or what I see, Suzanne, is that the average person doesn't even really have the time or the energy to think about it. So they're just going to the store, they're doing what most everyone else does, and so they figure that's the right thing to do. And it's not until, you can take a breath and take a pause and actually look into it like you do and say, wait a minute, it is so crazy how the toxins can be damaging, the pesticides on food, that it's hard to wrap your mind around, and we know that some of the countries won't take our crops because they're overly pesticide in use or not even getting into...
Or our chickens. Russia will not take our chickens.
Yeah. So it's hard to believe that, Hippocrates said, nutrition shall be your medicine. And the way I understand it, actually he said food shall be your medicine.
Right.
But what he meant was nutritious, nourishing food.
Yes.
And so that's really how you connect the dots on that.
Some nights I'll make a roast chicken, and I'll put olive oil all over the chicken, and then I'll sprinkle turmeric all over it, and then fresh rosemary and sea salt and roast it. It makes a delicious juice. But when I'm eating that chicken, I think this is like eating, because it's organic chicken, of course, a delicious medicine. And I think that falls in line with what you're just saying about Hippocrates.
Yes.
We're coming to the end of this wonderful interview. By the way, Dr. Drucker is in Encinitas, California. He's a Forever Health doctor. And Forever Health is, as I said at the beginning of the interview, a consortium of doctors who are understanding the effects of the environment and chemicals on the human body and what it's doing. Your specialty is chelation and female hormones, and I see that you understand the gut. You understand the biggest picture. In closing, when somebody's watching right now, and they're at their wits' end, they don't know what's wrong, but they know they don't feel right. What would you say to them about what you have to offer?
Right. So we call that sick and tired of being sick and tired. So when you get to that, just really understand that the functional medical model will do a lot to help restore health in any individual. Any individual, we can restore health. And actually, we're not doing it. You yourself, the patient, is going to make it happen by taking our tips and advice and guidance on how to eat, how to get nourished, how to detox. Whether you need chelation therapy, we'll find that out. Maybe you need more chemical detoxification, we can find that out. We're very big, for a medical doctor as opposed to an osteopath, I'm big on structure. So if someone has a neck that's chronically bothering them and it's in pain, a low back, whatever that structural ailment is, it's going to drain the life out of you like there's no tomorrow. So we're going to make sure that structural issue gets addressed and it gets cared for properly, so that it doesn't take all your body's resources. That's what happens. It takes all the body's resources. And I see so many people who end up sick after they had an injury, car accident, a dance fall, sports accident. And they live with this chronic discomfort that they feel they're stuck with, and it takes their health down. So it's another big area we address.
Hey, I did Dancing with the Stars last year and landed on my tailbone. I think I'm going to come down to Encinitas to have you get me right.
That's a big one, yeah. That tailbone injury, we see that all the time.
Yeah, sciatic, jaw, TMJ, all these things get activated by an injury. So what you're saying is the patient has to find it, that would be you, want it, and then be compliant, because there's no sense going to a doctor such as yourself if you're not going to do it. But I do believe by the time they find you, they have found you, they want it, and they will be compliant.
Let me say real quickly, Suzanne, lastly, thankfully, there are people like you. There is good food around, okay? So we have all these stores, Whole Foods, Trader Joe's, all the independent health food stores, and there's a ton of other good practitioners. So people do not have to be stuck with these health issues and just Western medical model. We can get you fixed these days.
You know, I can just feel that there are people watching right now going, this is exactly what I was looking for, because they're not getting the right answers. Congratulations on going back to school, by expanding and broadening your horizons, by acknowledging that the planet has changed, the environment is affecting all of us, and I really admire the great work that you're doing, and I look forward to meeting you.
Thank you. It's been a pleasure.
For me too. Excellent. Thank you.
See you soon.
Yes.
Okay.